And I'd like to turn it over to my colleague and friend, Dr. Adam Becker.
Thank you, Laura, and thanks everybody for inviting me in here to the full session of the DRC. I'm here to talk about the Pediatric Disaster Preparedness Self-Assessment for Children's Hospitals, which we affectionately call the PDPAC. As Laura said, my name is Adam Becker. I'm at Lurie Children's Hospital, where I co-lead the Evaluation Service Corps of the Pediatric Pandemic Network, along with Kate Remick, who I think all of you know. And the PDPAC is one of the major components of the PPN evaluation, and it's also an important element of the Disaster Response Collaborative, which we'll talk about. So the purpose of the PDPAC is to have a recurring national assessment that measures progress in pediatric emergency, disaster, and pandemic preparedness among children's hospitals. It's really the first of its kind. It will be or is being distributed to a curated list of 187 children's hospitals across the US and some additional representatives, members from the Disaster Response Collaborative. Number of objectives for the PDPAC. First is to establish a baseline to help us understand where we are as a nation in terms of pediatric emergency, disaster, and pandemic preparedness. To identify the strengths and gaps in current disaster response policies and preparedness practices in children's hospitals, to help us monitor progress over time in improving pediatric disaster preparedness and response capabilities, to enhance collaboration among children's hospitals across the country and others in pediatric disaster preparedness events, and to support the needs of our communities, the children and families in them, to make sure that their needs are met in the case of disaster events in their communities. Also important to note, the PDPAC is the environmental scan for the DRC, which I think you've been hearing about. The next slide, please, Deneen. Thank you. So why are we conducting this, the PDPAC? As you may know, the PPN's work focuses on enhancing pediatric readiness and disaster preparedness in the nation's children's hospitals and supporting their contributions to disaster preparedness in their communities. So the PDPAC is the first standardized approach to measuring pediatric disaster preparedness. It's based on the checklist of essential pediatric domains and considerations for every hospital's disaster policies. And we strongly believe that national and regional results from the PDPAC will contribute to a national dialogue on how we define, measure, and strengthen pediatric disaster preparedness by helping us understand what's currently in place across the country and identify opportunities for improvement. Again, the PDPAC serves as the environmental scan for the Disaster Response Collaborative. De-identified data will be aggregated by DRC focus areas and shared with the focus area leaders to inform their strategy development to support your work going forward. Next slide, please. Thank you. So a little bit of background. The PDPAC was developed jointly by the PPN Evaluation Service Corps and the Quality Improvement Service Corps, so the evaluators and the folks who run the DRC. Assessment questions are based on the disaster checklist with the addition of questions about children's hospital community preparedness activities, or how you advance preparedness outside of your institution, and the partnerships that you engage with to do that. The PPN domains and service corps who have content expertise in all the areas in the checklist helped us to draft and prioritize questions for their respective areas of expertise. And so we have questions in a wide range of topics, all related to disaster preparedness and response. You see the list of topics to the right here. And there are a number of benefits, obviously, to the network as a whole, but also to participating hospitals, and those are listed below. Participants will have access to benchmarking data to help you compare your institution's results to the aggregate results from your region and also to national aggregated results. The environmental scan for the DRC will help identify planning for improvements and the strategies that you'll encounter within the DRC. And there are a number of thank you items and opportunities for professional development that we're offering to those who complete the assessment. So there, we hope lots of benefits to to make this endeavor enticing. You can go to the next slide. So the PDPACH process, children's hospitals of all types will first register for the PDPACH at our website, pedspandemicnetwork.org, under the Get Involved heading. And at the end of my presentation, I'll have a QR code that would take you right there if you want to. Hospitals would then identify a lead person who would coordinate the assessment process and response. It could be the person who registers your hospital. It could be someone else. The registration asks if you, the person registering, will be the main contact, or if there's somebody else. So it gives you an opportunity there to do that. The primary contact then will have an opportunity to assign the different sections of the assessment to different subject matter experts or leaders within your institution. So for example, if there's somebody who isn't the primary contact or the DRC representative, but who's an expert on your hospital's telehealth program, you can assign the telehealth section to that person. So we're doing everything we can to make it easy for people to get the assessment questions to the right people within their institutions. There is also a downloadable PDF of the entire assessment that will be sent to the primary contact person, and they can share with others. That will help people see what questions are there if they need to get any information or materials gathered before they complete the assessment. The assessment platform, which is out of Seattle Children's, it's REDCap, will automatically send reminders to the primary contact and to any people who have been assigned by that primary contact for different sections on the hospital. Once submitted, so once the different sections are completed, the primary contact is the only person that will have the ability to submit the response on behalf of the institution. So there's kind of a coordinating step there, which I think a lot of people are happy with. It increases their confidence that their hospital responses will be appropriate and accurate. Once the assessment is submitted by the primary contact, a second brief survey pops up to guide the primary contact through the selection of the thank you items. So that comes right after the submission. Our hope is to get responses by May 31st. The sooner the focus area, the DRC focus area submissions are complete, the sooner we can get data to your leaders of those focus areas so that they can work on strategies to support your efforts. So I'm hoping now we've got a couple of folks who can talk about their experience registering their hospital and getting the assessment submitted. So Hillary Hughes, are you here?
I am. Sorry, I cannot get this Zoom to work on my computer, so I'm on my phone, but I'm happy to share what we did as our team. So I printed off the PDF. I did not send individual. Adam just talked about how you can pick different people to get emails for different sections. I didn't do that because I was worried I would just get things lost. And so I asked everything to be sent to me, which is not the right way to do it. It's just the way I chose to do it. And then I printed off the PDF and turned it into a Word doc and then filled in as much as I could and then emailed my team and said, these are the answers that I think are right. Could everyone look this over? Can everyone add? And then we met briefly just for 30 minutes on a phone call. And I had my mental health expert and my emergency manager and my program manager and myself and Annette, who is the manager of everything, just meet together. And we went over the answers and just felt that we got a consensus. And then with that, I took the Word document and opened up the survey and then used that to fill my survey results. I will say I totally made a mistake where I went off of a older version of the emails that went around once. And so I did have to correct a few things. So don't be me, just make sure you have the most up-to-date version of your answers before you go in there. But I felt like it worked really well. It was not complicated. It didn't actually take that much time for me to go through the PDF and anticipate what the answers would be. And it was pretty much consistent with what my team felt. I did have to reach out just to verify our overall bed counts and average patient volumes. I just clarified that with my medical director of our emergency room and just made sure that I had those numbers right. That was the only thing I felt like I had to go to an external party just to make sure it was correct. But overall, it was a really easy process. I definitely recommend either printing out the PDF or doing it as a Word on your desktop and making sure that you know what's coming and you know who to reach out to if you aren't able to answer any questions.
Thank you, Hillary. And then Morgan Dunleavy. Dunleavy, sorry. Is Morgan here?
I do not believe she joined yet, but I think Joelle offered to give us some feedback as well.
Yeah, is Joelle here?
I'm here.
Great.
Yes, I'm at Children's National and did something very similar to Hillary at Primary Children's and actually had a bit of fun with it. I know that may sound a bit nerdy, but a group of us, about 5 of us, got together and represented a person that is our emergency manager, our person that's in charge of our mental health services, our PPN hub PI, myself, and someone who also does a lot of our work in our disaster space, another physician. I'm the associate medical director for disaster. And it was, we did it in an hour on the call. We should have had the foresight to print off, but what we would do is go through, and if we didn't have an answer, one person would peel off and sort of text or check with their friends about like what the answer is, and then we would come back. So within the hour, we actually got all the questions answered. And it was a nice awakening to see how we interpreted some of the questions, but was very doable and pretty straightforward.
Great. Yeah, and I think Laura or someone just put in the chat, if there's anyone else on the call who's got experience registering your hospital or registering and completing or registering and you're in process of completing, please feel free to share your experience. It looks like if you raise your hand or tell us in the chat, we can unmute you and you can share. Okay, Mark. Mark Auerbach, Laura, if you can unmute him or somebody can unmute him. Yes, no? Okay.
All right, success. So I think, thank you so much for all your work on this. I think that I had a comments and a question. One of the challenges that I think is coming up is engaging with children's hospitals within our region. And I was wondering if others had tips or tricks related to that. My strategy initially was just to send some of the DRC contacts or DNC contacts, as well as some of the social networks that I have. But I wanted to sort of find out from others the open-ended of, you could register on here. So one of the things that I've done is said, email me to confirm you will be doing this, as well as concurrently register. But I didn't know if other people had suggestions to address, outside of their hospital, the other children's hospital in the region, which is, an additional opportunity / challenge for this work. Thank you.
Yeah, thanks, Mark. Yeah, and we've got a series of asks for DRC participants. One of them is to reach out in their network, so that would be a relevant point when we get to that. But yeah, if anybody has some success stories in getting other people to register, it looks like Dr. Harris.
Yes, you should be able to unmute Dr. Harris.
Okay, I think you can hear me. Yep.
Yeah.
Can you guys hear me?
Yes, we can.
Yeah, thanks. I mean, similar to Mark, I think it's been a lot about just using like social networks in the area. We've begun to establish some newer relationships through the New York City Pediatric Disaster Coalition. So if you belong to a healthcare coalition locally, that's another great avenue for, I think, not just generating those relationships, but using those new pathways to get some of this work out. So there's a big call out for the New York City Pediatric Disaster Coalition, but obviously one of many around the country that can help facilitate a lot of this work.
Yeah, thanks for that. Yeah, and we're really hoping that this opportunity to benchmark and sort of see how your institution lines up with the aggregate of hospitals in your region will be useful for all of you. And so the kind of general rule we follow is once there are 5 institutions from a region that have submitted, we will then start sharing the kind of aggregate, benchmarking information. There will soon be a dashboard within the PPN portal which I think folks you are probably all connected to by now, or you're in the process of connecting to the portal for the DRC. So for those who submit, there will be a dashboard specifically for you where you'll be able to see how your responses compare to the aggregate, again, within your region and then across the country. And those numbers will evolve as more and more hospitals submit their responses. So we're really looking forward to hearing from all of you. And I know that your focus area leads are really anxious to get the results for the focus area sections to really inform the strategies they're developing to support your work. Anyone else? And I don't know if Morgan has been able to join or not. I know she had some conflicts. Okay, let's go to the next slide. Thanks, Deneen. So here are our asks of you. First and most important is to ensure that your institution is registered. You can do that yourself, even if you're not going to be the lead contact. Doing the registration doesn't commit you to being the lead contact. It just opens the lines of communication between the assessment platform and your institutions. So please encourage, if it's not you, your hospital's lead contact for disaster preparedness or emergency management and response, to go to the PDPACH registration form and get your hospital enrolled, and then all the kind of assessment links will follow. We will also ask that you mobilize your hospital to complete the assessment by the 31st of May, if at all possible. Your institution's primary contact will coordinate those responses, and as we've said, they may be completed by different people. So it may just be making sure that the folks that have gotten the links are opening them and answering them in a timely way. And then supporting your colleagues by encouraging them to complete their sections, connect them with others in your institution who may have information they need. Mark and Dr. Harris both talked about connecting with others to encourage other hospitals. We would love for you, once you get through the process or start the process, to share the news of the PDPACH launch with other children's hospitals to encourage them to register and complete the assessment. Again, the more within your region that submit, the stronger the comparison data will be. And then to learn more about the PDPACH page is officially live on the PPN website. There's a brief overview of the assessment and a link to the registration page there. And you can go to the next slide. Okay, so just a status check. This is where we are today as of the 5th. We so far have, out of the 187 plus hospitals that are on our list, 52 of them have registered. 37 of those have had the link sent, which means that those are the ones that have already identified their primary contact. So the other 15 are registered, but they haven't completed registration by identifying their primary contact. And we have 6 completed assessments already. And then below the dark line there, you see the breakdown of DRC and then the list of 187. So we have 35 DRC participating hospitals already registered. That accounts for 31% of the DRC hospitals. Of those 35, 27 of them have received the invitation links to start the assessment, and 5 of them have completed. And then for the entire list of 187, which includes some hospitals that are not in the DRC, 44 of those have registered, 24%, and 33 have been sent the links to start the assessment. 5 of those have submitted. So we're well on the way, and soon we'll be able to update by region and by focus area as well. So we hope that after today, these numbers will drastically increase as you all get your hospitals registered. And the final slide is just to thank you for your time and to give you the QR code. If you want to just go ahead and get to that registration page right now, the QR code should take you there. And if we have time, Laura, for any questions, we can entertain them. I don't see any in the chat.
I can mention something, Adam.
Yeah.
Just to let people know, if this didn't come up in the previous comments, that if they aren't sure if their hospital has registered, they can ask, because it's okay for multiple people to register, and Adam and his staff will sort out who is the primary contact, and then help them as needed. So don't hold back if you think that your hospital might not have registered for the PDPAC. I would go ahead and do it and let us work with you to make sure that the right people are involved.
Yeah, that's absolutely right. Don't hesitate. You can go ahead and start the registration. We have a system kind of in the back end to see if we're getting multiple registration openings for any one institution. And the system is set up so there can only be one primary contact. So it takes care of that for you. So the registration itself is just the first step to kind of open the communication. So don't hesitate. No problems with, a second attempt to register and that kind of thing. Thanks for that.